Hi everyone, welcome to Origyn IVF. I am Dr. Rashmi Sharma, and today we will be speaking about a disease called endometriosis, which is a very painful disease. I know the patients who are suffering from it, they understand the pain of this disease. But before that, if you wish to consult at our center, if you wish to come to our center, then the number is given below at the screen. You can give a phone call and get an appointment at any one of our centers in Delhi. Or if you wish to consult by teleconsultation, the app details are also given below in the description box. You can book a teleconsultation appointment and you can take a consultation. Now coming to the topic of the video today, which is endometriosis. So many of you must not be even knowing what is endometriosis or how it happens. So before coming to how endometriosis happens, it is important to understand that how periods happen, because it is related to the periods. Okay, so for the period, we know there are three layers in the uterus: outer layer, middle layer, and the innermost layer. The innermost layer, which we medically know as endometrium, is where the baby implants. That is the soil for the baby. So this endometrium is getting prepared every month whenever the uterus is preparing itself for pregnancy. So every month during the menstrual cycle, an egg is forming and the endometrium is getting ready for pregnancy. But if the pregnancy does not happen, then what happens? That inner layer gets shed off, or the endometrium layer gets shed off during the periods, and that's how menstrual blood comes out of the vagina. So this is how a normal period happens. But if those tissue layers, those inner layer tissues are also there outside the uterus, sometimes they're outside the uterus also, on the tubes, on the ovaries, on the intestine, in the other parts of the abdomen also, then it is called endometriosis. So when the endometrium is getting ready, those tissues also are getting ready in the outer side of the uterus, and when it bleeds, those tissues also bleed. So for the uterus, for the inner layer, there is a way to come out, but for those tissues, there is no way to come out, and the blood starts accumulating inside the abdomen. And slowly and gradually, over a period of months, over a period of years, that blood is getting collected over there in all the organs of the abdomen, and all the organs, they start getting sticking to each other. Bowel with the bladder, uterus with the ovaries, everything starts sticking to each other. This is what is endometriosis. And sometimes that blood collects in the ovary and it forms chocolate cyst. Why it is called chocolate cyst? Because when you cut that cyst, a chocolate colored fluid will come out. Chocolate colored fluid is nothing but old collected blood. This is how endometriosis happens. Okay, so now coming to what are the symptoms, how can you diagnose? So sometimes there are absolutely no symptom. Patient may be absolutely asymptomatic. And during the routine examination, when we are examining the patient for infertility, in a routine ultrasound, we diagnose that this patient has a cyst or a chocolate cyst, then we know that this patient has endometriosis. In other times, pain is one of the very important symptoms of endometriosis. So painful menstruation and painful intercourse, two very important symptoms of endometriosis. Also infertility. So three main symptoms: painful menstruation, painful intercourse, and infertility. Pain can be of differing severity. Some patients have pain only during the periods. Some patients will have pain preceding menstruation, after menstruation also, and sometimes the pain may be so severe that throughout the month they are having pain and they are really troubled by that pain. I remember one or two patients of mine in my practice where even the unmarried girls have been brought by their parents. They are so troubled by the pain that they request us that, ma'am, please remove her uterus. Sometimes the pain can be so severe and it can really affect the quality of life. Now coming to how do we treat endometriosis? Okay, so treatment of endometriosis will depend upon patient's desires of having a pregnancy or not. So if the family of the patient is complete, or if the patient is young and right now not desiring a pregnancy, the treatment is different. But if the patient is desiring a pregnancy or the family is not complete, then the treatment is different. So I have already spoken about how to treat infertility in case of endometriosis in my earlier video. So today I will talk about those patients who are not wanting pregnancy right now. So as I told you that this disease is because of the periods. Because the periods are happening, that's why the inside tissues are also bleeding. So one of the basic treatments of this disease would be to stop the periods. The stopping of period could be either by the means of drugs or by means of the surgery. Surgery is done for patients who have, who are older age, like 38, 39, 40, 45, and they're really troubled by the pain. So in those cases, uterus and ovaries both are removed. It is important to remove the ovary also, because if you do not remove the ovary, the hormones will continue to continue to be there, and that inside bleeding will continue to happen. So this is for surgery. But for those patients in whom we are not doing surgery, there are certain drugs which can be utilized to stop the periods. Like one of the drugs may be Dymogest. So that's a progesterone hormone which is given daily, sometimes for 3 months, sometimes for 6 months, and sometimes with a break. So that kind of suppresses the endometrial lining, and kind of helps in controlling the endometrial disease, endometriosis disease. The other drugs that are utilized are oral contraceptive pills. That is also very commonly given. So here my message, especially to the unmarried girls, is that if you have been diagnosed with endometriosis, it is very important that you should be taking drugs to suppress it. You should not think that drugs are going to harm you. In fact, if you do not take the drug, you are allowing the disease to grow further, or to progress further. So it is very important that a patient of endometriosis continues to take the drug to keep the disease in check, to keep it in control. Okay. When the disease is severe and the pain is not getting controlled with the help of Dymogest or oral contraceptive pill, the other injection that, one injection also has been utilized in its treatment is leuprolide depot. So that's a depot injection which kind of shuts off our pituitary gland. Okay, this kind of shuts off the signal from the brain for periods. It kind of creates an artificial menopause for some time, temporary artificial menopause. Okay, so there are injections which work for just 1 month. There are injections which work for 3 months. So one injection working for 1 month, one injection working for 3 months. Of course, these cannot be given for very long period of time. They are given for maybe 3 months, or sometimes maximum for 6 months, because they are creating a menopause-like situation. So they have got a little side effects also. But these are the treatments that have been utilized for treatment of endometriosis. So I hope this video will be useful for you. And we have already talked about that if you're suffering from infertility and endometriosis, then how should we go about your treatment. You can go back to that video and see that video. If you have any questions, you can write down in the comment section below. I would be happy to answer those. Thank you.